Hey guys, been an awesome day fixing Hallux Rigidus with joint implant, the arthrosurface. I have two awesome videos to share with you. Two patients today, back to back. One had surgery 6 years ago with me with the arthrosurface. She wants to make the other side even today. And the other one's a new patient for arthrosurface. You can see the pathology of Hallux Rigidus as well as see how the implant is put in and how it's going to make a difference for the patient. You'll see immediate increased range of motion, and you'll see some of the pathomechanics behind this Hallux Rigidus deformity and disease of the joint and how it looks like in the actual joint. Warning, these are actual surgery pictures, so if you are squeamish, please do not continue. On the left foot now. This clinical presentation again, the bump on top. Oh, limited range of motion, is not moving. She's under anesthesia right now, and I also blocked her. So watch this, it stops, it's jammed, it stops right about here. It stops right about there, it's not moving. After surgery, you want to get it about 90 degrees or close to it, that's the goal. That's where I want to be. Right now it's down here. I want to go ahead and bring that big toe up about this high by the time I'm done with the surgery. You go ahead, clean this out, same as the last patient. Again, it's stuck right here. It hurts with every step. We're going to go ahead and fix it. Let's do it. Number two. It's in the middle, but you still see a lot of this junk right here, a lot of this inflamed tissue, inflamed cartilage. We're going to go ahead and clean this up. In the next shot, you see all this cleaned out and the joint moving correctly now. So right now, again, we have the implants in place, seated in place correctly now. I'm just going to clean up aggressively and get this joint moving. Next shot. Next implant of the day. This is patient number 2. You see that big bump is gone right here, and it's all cleaned out. The arthrosurface implant is in. The metatarsal right here, we're right in front of the metatarsal on the x-ray. We see that. The base of proximal phalanx has been cleaned out too, very aggressively. So now when I put it back together again, it's going to move. It's going to move where we want it to be without jamming or causing any kind of problems. Right here. Again, it's nice and smooth. As you can see from the side, we're going to look down at it. I can get it to 90 degrees on the table right now. Realistically, it'll probably settle in right about there. But that's 90 degrees right now. That's a good starting point versus before. So again, this is arthrosurface. You can take a look at it. There's no jamming in there. Implants in place. Movement is perfect at this point. Nice and smooth. No jamming. Nothing holding it back. Again, we're going to take a look at this again one more time. On this view, no jamming. Again, we don't need this to walk anymore. We're going to use what nature intended. But look at that. We're going up right here. The joint is in good condition. Arthrosurface number 2 for the day. Arthrosurface closed now. Now we're been fully closed. Look, the range of motion is perfect. Gliding perfectly normal. Her toes looking really good. Right here. A little bit of bleeding here. Just got done with surgery. So right here. The range of motion is perfect. We're going to go on the side and look up and down. The range of motion we have close to 90. That's what I want again. Again, this is the range of motion that we want. Okay, again, range of motion that we want. She's going to be able to walk with this without pain, without restriction. This is the arthrosurface implant. And we're good to go. Well, grossed out yet? That is one patient. The second patient will be coming up very soon. Again, the second patient, I did her left foot about 6 years ago, and she's in for the right foot today. She's very happy with the left foot, done 6 years ago, no pain, and she's able to go about all her activities. The next patient is actually also 76 years old, very active, very athletic, very good shape, excellent bone stock. So she's a great candidate for this implant because, well, she had it 6 years ago and it was perfect on the other foot, and she just wants the other side taken care of. So enjoy and see the outcome. We're going to move it. It's not moving. It's jamming. A lot of pain. We did her other foot. You can't see it, but the other foot is moving very well. Did her other foot about 6 years ago, and she's doing great, so we're going to make this even. We're going to do the arthrosurface implant. Again, this is going to go here. We're going to look at some intra-op photos, pictures, videos, and some post-op. We'll go from there. Thank you. Dissected down to the joint. This is the first FPJ inside. The same patient last time. You see there's a big loss of cartilage right about here. So again, this is the osteophyte or the arthritis that you see on top. The joint's very irregular. This is cartilage, very minimal part. This is no cartilage right here. And then over here, you have some loose fracture fragments right about here. These are all loose. This is bone that's loose in the joint that's causing a lot of pain. Now we're going to go ahead and resurface this thing with arthrosurface, and we'll go on from there. Thanks. This is the range of motion immediately after surgery. We still have the 90 degrees right here. The joint, there's no impinging. We see there's a nice range of motion here. There's no crepitus, no impinging, and we're about 90 degrees right about here. That's what I want, close to 90 degrees at least. So that's the amount of degrees I want of dorsiflexion right after the surgery. Again, here you go, range of motion, no crepitus, very nice and smooth. No bone on bone. We're looking good. And we can stop. After you've seen those videos about the actual surgery that I've done today for Hallux Rigidus with the arthrosurface implant, here is a little bit of what it looks like in a cartoon method. In a cartoon right here, you see that's Hallux Rigidus. I explained to patients so many times that I've took off some of the marks. But basically, you have bone spurs in the first toe joint and is very, very narrowed. A normal first toe joint will actually be nice and smooth around, right? Nice and smooth right about here. Okay. Some of the older implants look like this. It's called a silicone implant. They will put a silicone implant in between this space. It's called a spacer. So that's what that looks like. This is an older poster, so I don't have the arthrosurface on here. But basically, the arthrosurface is we're resurfacing this joint right here. So we take all this off. All this is taken off. All the bone spurs on top are taken off. But we also put that implant right about here. So this is replaced. This is not replaced because when I'm in surgery, most of this cartilage is intact. So it doesn't make sense to damage this for the sake of fixing a joint when this is the joint that's bad. So the arthrosurface is actually the first implant that's come out addressing this problem, and I've been very happy with it. Patients have done really well. So again, the implant goes, it's called a hemi implant. It goes right about here in this area, and there's a stem that comes in where this implant pops right into it. That's why patients are able to walk right away. So the results have been excellent, and read more about it. Come visit us at www.naples.podiatrist.com and give us a call, 430-3668. 239-430-3668. Follow us on YouTube, subscribe to us, follow us on Instagram, as well as LinkedIn, all the social media networks. We're on there. See you soon.